I arrest doctors and nurses who kill their patients. I'm the retired special agent in charge of the US Department of Veterans Affairs OIG. Ask me anything. How does one find out that doctors or nurses intended to kill their patient? It usually begins with statistics. Every time a particular nurse or doctor is on duty, the death rate goes up. He/she takes time off, the death rate goes down. These are patients that were not suspected by family or staff of being near death. How do you differentiate between an incompetent doctor and a murderous doctor? Are you using these as a statistical warning sign for further investigations? Murder is a question of intent to kill, not one that is killing because of incompetence. But the aforementioned statistical approach, higher death rates, does not differentiate the two. Do I assume you must have a way to tell? The higher death rates is just the first red flag. Then an entire criminal investigation must begin to determine if these patients expired as a result of their natural disease processes or something more sinister. How do they usually do it? Insulin, potassium, insulin, epinephrine, succinylcholine, potassium, to name a few. That means if he did it just once or twice he can get away with it. The more hospital murder, the more likely of getting caught. Unfortunately, it seems to take a good number before any eyebrows are raised. I mean, fair. A sick person dying in a hospital isn't exactly news. Exactly why they get away with it for so long. Any life hacks for how to not be murdered, or is it just random chance? How are most of the murders committed? Is there a specific bracket of people most at risk? What was the most difficult to determine murder? Gods, this feels callous to ask. The very old have been the majority of victims, but certainly not exclusively. The murders are committed in the hospital, usually around 3 AM, when few people are around. It is very difficult to prove murder in a hospital setting. Do you think installing more surveillance cams throughout the hospital will resolve this issue? It couldn't hurt, but with HIPAA you probably won't get to see what you'd hope to see. Was there somewhat of a common motive between the doctors and nurses that you had arrested? I.e., why did these people do it? By far the most common motive has been Munchausen syndrome by proxy. Intentionally putting a patient into code, then showing staff what a great caregiver you are by trying to save their lives. Like the fireman who burns down the firehouse to show off his firefighting skill. When you look at MSP in parents, they keep their children alive for many years and the child only dies when they fail to rescue them. So are the deaths of patients only the tip of the iceberg, with there being many patients that were assaulted but survived the assault. Yes, there were survivors, even when Dr. Swango tried to kill them, but no one believed that this doctor had tried to murder them. Is it murder then? If the intention is to save the patient, but for whatever reason they fail, wouldn't it be manslaughter? They couldn't care what happened to the patient. They have no intention of saving the patient, only putting on a good show. As someone with a lot of medical problems, am I at a high risk to be a victim of these people? I'm in and out of the hospital a lot and get lots of procedures done. Make sure you don't go in alone and have an advocate with you to politely question what is being done. What do you think the motivation for the killing is? And what is the most insidious method you've seen? I know my mother's doctor tried to kill her through neglect. About a year ago it seemed like she was dying. I went with her to see her primary care physician, and I asked him if it could be her meds causing it. He and the prescription coordinator treated me like I was a moron for even asking. He poked her in the back a few times with his hand and sent her home. When she got home, I went through all her pills and researched each one and asked her what new ones she had been prescribed. It turned out there were about 4 pills she shouldn't be taking with the Prozac she was recently prescribed. I finally convinced her to stop taking the contraindicated meds, and she got better literally overnight. She went from being wheelchair bound and basically on the verge of having a heart attack constantly to being able to walk around, and now she feels fine. She was suffering from serotonin syndrome. Good for you. Wish more family members would get involved. Don't confuse malpractice and incompetence with murder. My subjects all intended to kill their patients. How many cases on average did you see throughout your career? What is one case that sticks out to you? Thanks for this Ask Me Anything. I have personally been involved in 4 cases, but have discussed these cases with other investigators from around the world. There is going to be the first international conference on the investigation of medical serial killers at John Jay College of Criminal Justice on March 20th. 2020. Are you at all concerned that having conferences and bribing more attention to this would breed more copycats? Nope, no conference in the world will have any impact on the desire of these killers to keep murdering their patients. How do you determine if it is just negligence or murder? Do you also make sure the negligent are punished as well? The negligent are usually punished through civil and administrative punishment, not criminally prosecuted. Yes, but how do you determine whether it was negligence or purposeful? Not easy. However, if there are multiple drugs given to a patient that was never prescribed the drug, that's a great beginning of a criminal investigation. What is the saddest case you worked on? They are all very sad, but for some reason one of the saddest is when we determined that Michael Swango had been poisoning his fiancée. Did you see that case recently where they injected kids with insulin instead of a vaccine? Horrific. Yes, that is the case of 10 people injected with insulin instead of the flu vaccine. Not murder, but terrible nonetheless. Is there no way to detect that they were used improperly? It is extremely difficult to detect these drugs hours, days or even years after they have been administered, particularly if you don't have any early suspicions of what drug was used. What did the worst person you ever arrested do to their patients? How many patients did they kill? Michael Swango killed about 60 patients all over the world. Swango murdered about 60 patients, but he doesn't hold the records. Harold Shipman in London does. Don't they call themselves angels of death? As they think they are being merciful. The press gives them that title, not the perpetrators. As a student of psychology, killer nurses and doctors are a particular fascination of mine, ever since my mother told me about the serial killer Beverly Allitt. I'm fascinated by what makes someone who spent so many years learning to care for people and heal them suddenly turn and kill them. Have you noticed anyone, however small and insignificant, that these kinds people all, or mostly, have in common? Again, in my experience only, the majority have been Munchausen syndrome by proxy. Many are sociopaths who could fool you into thinking they are the most caring of people. Many have had incidents in their lives outside of the hospital as well. That's very interesting. Is there a regular pattern of behavior that they follow when committing their crimes? They just keep working like nothing bad is happening. Is that because they don't see that anything bad is going on and believe everything to be normal, or because they are just good actors? I'd vote for good actors. What are your feelings/concerns about MAID? Sorry, I'm unfamiliar with that term. Medical assistance in dying, a program where patients can ask for euthanasia in cases of terminal conditions or irremediable suffering. We have it at my hospital, and it's available at many others. Thank you for clearing that up for me. I'm not opposed to that if the patient, family and medical professionals all agree. Interesting. Why do you think the family should have much of a say? Because if you are inclined to murder, or even take shortcuts, it's going to be for a patient that is basically left alone and no one seems to care about. So you're suggesting that the family is present and aware of what's happening, not necessarily that they have a say. I'm suggesting that they politely and calmly question and document the care being given and the drugs being administered. Do you think the murdering doctors and nurses think they are providing relief, or that these patients want to, or should want to die? I don't believe that. It is all about the excitement they receive by causing a patient to code. They couldn't care less about the welfare of the patient. I don't buy that argument, but some killers have tried it. How often do hospital administration members get investigated for potentially covering up for the killer doctor/nurses? I'm glad you asked that question. Frequently investigated but never prosecuted. Usually they move on, retire, or are administratively sanctioned. In Germany, the police are now pursuing the administrators that allowed day nurse murders to continue. You mentioned you're now retired. What are you up to these days? Still working as a private investigator and author of Behind the Murder Curtain and a new book, to be released soon, The Art of Investigation. Where/how do you hear about a doctor/nurse killing their patient? I mean, like, if there's a doctor that kills their patient, how do you get the news about it? Does the family report to you guys, or is it the hospital that does? These cases usually come to our attention from the honest, dedicated staff that suspects something. Their complaints are usually rejected by management, so out of frustration they go outside the hospital. What's the most bizarre and weird story by which a doctor kills a patient you know? Dr. Cornack in Albany altering medical records to put people into research studies. Killed patients for the profit motive.